What's up, everybody? Welcome back to the Injuries Explained project, where we are on a hell of a mission to make chronic injuries obsolete by helping those that are injured and in pain get properly educated and informed on all their treatment options so they can have the best possible outcomes without ever having to resort to pain pills, injections, or surgeries, which only make things worse. My name is Dr. Maggio. Thank you so much for stopping by and checking out the show. Just a quick disclaimer before we get started. All of the information presented in this episode is strictly my opinion and in no way, shape, or form should be misinterpreted as concrete medical advice or recommendations. If you are dealing with an injury and in pain, please reach out to a qualified medical practitioner for a full diagnosis. If you've already done that, you haven't got any real answers, you're frustrated as hell, and you just want to know what the hell's going on, you can reach out to us directly and request an injury consultation. All the information for that is available in the show notes. Now we got the boring stuff out of the way. Let's jump right into the show. I'm sure you're really excited to find out what this magical and mythical unicorn of pain and tightness and even weakness is. It's the most common cause of all these things. It also is the most underdiagnosed cause of all these things. And even better, it is the most fixable cause of all these things. Sounds pretty awesome. What is this magical thing? It's called scar tissue. Once again, scar tissue. So what is scar tissue? Scar tissue is like glue that gets inside the muscles, and it makes it harder for the muscles to be able to stretch and contract how they're supposed to. So probably saying to yourself, you know what? I do have pain. I do have weakness, and I sure as hell have decreased flexibility. And I'm sure you're now asking yourself, how in the hell could I have scar tissue? Because I actually never really got in an accident or had any real injuries to the area. So how in the hell did I get scar tissue? That's a great question. And I'm really glad you asked. So scar tissue does form in two ways. The first one that we all think of is just like an accident or trauma. Maybe you got in a car accident. Maybe you fell out of a tree. Maybe you got hit by a car. Maybe you fell in a hole. I don't know what happened, but that's usually 10% of the time where there's a really traumatic force that goes in, tears the muscles. It could tear the ligaments, could tear the fascia, and that scar tissue starts to form pretty quickly to try to buffer the area. Like I said, that's about 10% of the time. The other way, which is about 90% of the time that it forms, is just from overuse, bad postures, lack of movement, shitty diet, and lots of stress, essentially being a modern human in modern society. So when this happens, the muscles are constantly contracted and stretched. And when that happens is they don't get enough blood flow and they don't get enough oxygen. When this happens, it sends a signal to the brain and it says, hey, we're getting overworked here. We got to do something here to help with this problem that's going on. So what the brain does is it starts to pump out what's called collagen. Collagen is just like the building blocks of like muscles and ligaments and tendons and fascia. But it doesn't have enough time to like get good quality collagen out there. So it's kind of like half done, half cooked collagen, and it goes in there and then it starts to build up over time to start to support the area. Because when the muscles are getting overstretched and overworked, the body thinks there's an injury there. So it wants to heal it up and then wall that area off with that scar tissue. So that's how the scar tissue forms and why it's so common. So what happens when you get the scar tissue? First, it just it gets in the muscles first, it gets in the ligaments, and it gets in the fascia. When this happens, it makes your muscles just weaker and less flexible. And then eventually what happens is that scar tissue continues to get bigger and bigger as you have more stress, more sedentary postures. Maybe you're just like doing too much as well. You're like over moving. You got a lousy diet. You have a bunch of stress. That scar tissue starts to get bigger and bigger and bigger. And eventually as it expands, it starts to get stuck to the nerves. And there's actually 156 places in the human body where what's called a nerve entrapment, basically a nerve getting stuck, can occur. Can't talk today. And when this happens, it presents with like some numbness and some aching and some burning and even some tension. Here's the thing. When nerves get stuck, they don't like that, because if your nervous system doesn't work, you don't work. So what it does is it tightens up those muscles even more. And a lot of people might alter their postures and they'd be like, oh, well, my shoulders rolled forward or my head's rolled forward. Your body's just doing that to unload your nerves and getting your nerves compressed, because if your nerves get caught for too long, you don't work. And your body's number one mechanism is to protect your nervous system. So it'll sacrifice a lot of things around there. Now, the muscles, the ligaments, and the nerves, they can't work how they're supposed to. And what this ends up doing is it puts more wear and tear on the bones. And when it puts more wear and tearing on the bones, you get like bone spurring. It also puts damage on the cartilage, and you get some damage to like the labrum or the cartilage. You get degeneration in there. It puts more pressure on your discs and leads to degenerative disc disease. And then lastly, it puts pressure on your tendons. So you can have like tears, and I guess you can call it tendonitis and all that, because everything else isn't working correctly. So yeah, scar tissue is a really, really big deal, and it causes a lot of problems. And it's not something that like just happens overnight. It's something that kind of builds up. And a big question that I always ask when I'm doing a consultation or a history on a potential client is, was there a trauma or was there not a trauma? And if there isn't a trauma, I'm really thinking it's more of a scar tissue accumulation and things built up over time, builds up, builds up, builds up. Think of that scar tissue as like plaque on your teeth that builds up. Eventually, if it's in there for too long, it puts pressure on the tooth and causes a cavity. So that's what's happening in there. So let's review how some practitioners would view it or really try to address it. Number one would just be the orthos. Orthos, I mean orthopedic surgeons. Mostly they're just going to completely ignore it. And they believe all problems are due to the structural problems that I mentioned, like the disc, the cartilage, the tendon, and the bone. And a lot of what they do actually causes more scar tissue to form. If they do surgeries, they do injections. I'm going to have a whole podcast coming down the road about why injections actually cause you to make more scar tissue and also cause your tendons and joints to get even more degenerated from there. And basically what happens is the surgeons are really going after what I call the effect instead of the cause. The effect is the joint, the cartilage, and the discs and the tendons are all getting damaged, but it's because of that scar tissue. So think of like the degeneration that might show up on like an MRI or a CAT scan or even an X-ray as like your thumb being stuck inside a car door. The car door is all that scar tissue. So you can't give a chance for your thumb to heal until you remove that scar tissue. So with surgery, what they do is they pull that thumb out really quick, but then over time, it slams the door back down. And that's why a lot of surgeries make things worse down the road, and then they actually create more scar tissue. So now they got a bigger problem from where they are. The next are the physical therapists. They know that the scar tissue is a problem, but they're just actually not good at fixing it. Think of your scar tissue, and I talked about it, as like really deep plaque that's built up in your teeth. And it needs a really deep and focused, clean, very precise and focused, but their methods of like stretching it and strengthening it, it's very similar to like brushing your teeth and flossing. It's really important, but it's not actually going to fix like that decay in the tooth from where it's going, and it won't get to the root cause of what's going on. And it actually makes the problem worse. So they always think, oh, well, the muscle's tight, let's stretch it. The muscle is weak, let's strengthen it. You have to have that question answered. Why is this muscle tight? Why is it weak? And a lot of times it's because that scar tissue is building up over time. Maybe the nerves are getting compromised. There's a lot of other factors going on, and simply just trying to stretch or strengthen it can actually piss that tissue off and make it worse, because the last thing you want to do is when your tissue is really inflamed, full of scar tissue, is try to put a bunch of exercise and movement on it. It actually makes it worse. So physical therapists know the scar tissue's in there, but they just don't have the actual tools to fix it, because like I said, they're trying to fix a really deep problem in a tooth by brushing and flossing. It's too late for that. And then lastly, the chiropractors, they believe everything's a bone problem, and they don't even address the soft tissue components. I talked about this on my very first podcast, where I'm a chiropractor that doesn't do any adjustments, and I focus solely on soft tissue work. So I wouldn't even bother going to the chiropractor for really any issues. And I'll start to share that more and more as we go on. But yeah, they don't even address the soft tissue and think everything is just simply a bone problem, a very reductionist approach. Use the big fancy word there. So what would I do for myself? Because remember, this is just my opinion. It is not advice, but I always want to put it through my lens of what I would do for myself to see if scar tissue was causing my issues. Number one, I would get to a manual therapist. Your best bet would probably be a massage therapist, maybe a chiropractor that has advanced soft tissue treatment skills, or even a PT. But most of the time, massage is going to be your best bet because they have the best hands and skills to actually get in there and make a change in the tissue with their hands. Number two, they should do a very detailed functional evaluation where they're going to measure your range of motion and take you through a full history of what's going on. If you go to one of these massage therapists and they're just like, hey, fill out this quick form and jump on the table, they're not going to be able to help you. You need someone that's going to really get to the root cause of what's going on. And they have to be able to answer the questions of like, why is your muscle tight? Why is it weak? Not just simply jumping in there and doing a bunch of treatment and kind of see what happens. Imagine if you brought your car to the mechanic and your check engine light was on and the mechanic's like, we're not going to run any tests. We're just going to get in there and start hammering away. You'd be like, hell no, there's no way I'm going to let you do that. Like, run some tests and figure out what the hell's going on. Should be the same thing with your body and your injury. It needs to be figured out fully with a thorough and detailed evaluation. Then once they do that, then they perform a very detailed palpation. Basically, they're going to go in there and feel around and see where the muscles are stuck, where the nerves are stuck, where that scar tissue is present, so they know exactly where it is. And then lastly, they just specialize in a very advanced technique, ideally like something called like myofascial release, where they get like what's called like proper depth and tension on that scar tissue and then have you go through a full range of motion. That's what actually breaks it down. So you don't need like a massage therapist that's going to go really deep and just beat the living hell out of you. You need someone that's going to get the right amount of depth and the right amount of tension. And that usually comes with more advanced training in what they do. So that's all I got for you guys on this episode. So the best thing you can do is support the show by sharing it with others. I made this project just to get this information out there, help more people get properly educated and informed so they can stay the hell away from pain pills, injections, and surgeries, which only make things worse. If you are struggling to get an answer or a definitive diagnosis about what is going on with your own injury, you're tired of getting the runaround, tired of all the bullshit of the medical model, and just want some answers about what's going on so you can get on the path to actually healing, you can reach out to us directly for an injury consultation. All the information, like I said before, is available in the show notes. And lastly, just be active and take control in your injury resolution. Ask questions, challenge the practitioners, because nobody cares more about your health than you do. Appreciate you guys listening, and I'll see you on the next one. Bye.